Fox 5 Health News, and once you get your second dose of the COVID vaccine, the CDC says that you don't need to quarantine if you've been exposed to the virus, but you still need to follow guidelines.
All right, joining us now, Dr. Devi Nampiaparampil from NYU School of Medicine. Dr. Devi, thanks for being with us. And basically, as we get through this whole vaccination process, we've got to weigh the pros and cons as society as a whole. So this is one of those issues we have to sort of figure out. Once you've been vaccinated, what do you do if you've been potentially exposed to COVID? And this is sort of giving us some guidance on that front.
Yeah, exactly. I think it's good news. I mean, the one thing to remember is definitely if you have any cold or cough symptoms, if you have fevers, if you lose your sense of smell or taste, you do have to quarantine because then you're having symptoms. So in that case, you do want to separate yourself to protect others. But putting that aside, if you have an exposure to someone, so that means if you have close contact with someone who you know or you suspect has COVID, well, in that case, if you have received 2 doses of the vaccine, so that means the Pfizer or the Moderna vaccine right now, if you've received 2 doses, then you may not have to quarantine, is what the CDC is saying as of yesterday. So right now, the only people who have really received 2 doses are healthcare workers, essential workers, and some folks over the age of 65. So it really doesn't apply to everyone yet, but I think they're planning for the future. I think they probably will issue a little bit more guidance on this because I think it's going to raise more questions because right now, the reason that we wear masks, the reason that we physically distance or socially distance, the reasons that we're getting the vaccine is because we're not just protecting ourselves, we're protecting other people, right?
Which is so important.
Exactly. So if we get the vaccine, we still want to make sure that everybody feels protected. And, if we get the vaccine, we have fully vaccinated, we have a 90 to 95% chance of being protected ourselves after 2 weeks. But we don't know for sure if everybody around us is protected. So we might need some more clarification on that in the next few weeks.
Doctor, we're running out of time, but I want to ask you this because this is incredible. A new drug that is used to treat diabetes is being called a game changer, but researchers say it's a breakthrough because it's treating a different condition, obesity.
Yeah, so far all the drugs or treatments that we've had for obesity, other than bariatric surgery, have been pretty limiting. I mean, in terms of medications, people are limited because of the GI side effects like heartburn, nausea, bloating, diarrhea, etc. This one seems to have minimal side effects, but it's really effective. People have lost somewhere between 15 to 20% of their body weight. Wow. Relatively short period of time, which means a lot of protection potentially against diabetes, high blood pressure, heart disease, arthritis, even all the things that go along with obesity. So really could be a game changer, but we don't know yet about the cost and the coverage in terms of insurance.
Yeah, it seems like that'd be a popular drug for sure. All right, doctor, your 5:45 is out in the waiting room. We don't want to keep them waiting.
Yeah.
Thanks for being with us.
Tell them we're sorry.
Yeah, we appreciate it. Thank you.
Well, this was a wild scene in Brooklyn this afternoon as a pair of NYPD horses got loose. These are the streets of Midwood. The incident began after the officers were forced to dismount because one became ill.